Do your legs start to feel heavy, shaky, or even give out after standing for a few minutes? I'm going to show you a quick test to see if the problem is coming from your spine and one simple move that can instantly take the pressure off so you can stand longer without pain. Most people think that weakness in the legs means poor circulation or just getting older. That's not always true. It can be from a hidden pressure in your lower back that is quietly choking the nerves that power your legs. And once you understand what's really going on, you'll finally know how to stop your legs from giving out and get your strength back. Keep watching. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada, with 35 years of clinical experience. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash the subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and surgery. I upload a new video every week. Now let's start with a quick test you can do right at home. Follow along with me. If this turns out positive, I'll tell you exactly what to look out for and what it could mean. And just to be clear, this does not replace your doctor. It's not a diagnostic test. It's simply a way to understand what your body might be trying to tell you. Always get checked by your primary healthcare provider who understands these conditions well. Now, simply stand up the way you normally would. I want you to be relaxed, upright. Your feet should be about shoulder width apart. Stay there for a few seconds and notice what you feel in your legs. Do they start to feel heavy, tight, or even a little unsteady? Many people notice that feeling just after standing still just for a short period of time. Keep your feet where they are, and now I want you to lean forward just a little bit. Okay, just a little bit. You place your hands on the counter or on the table for balance, and you let your knees soften ever so slightly. It's a small hinge at the hips, not a big stretch. Hold that position for about 10 seconds and just notice any change. For a lot of people, that heaviness eases or the legs suddenly feel lighter just with that small bending forward. If that happened to you, that's an important clue. When you lean forward, you actually open up the space in the lower part of your spine, giving those leg nerves a bit more room. Very, very simple, right? Is remember, the nerves are exiting in the back. When we bend forward like that, we're actually opening up the space in there. That's what's taking pressure off the spinal cord, off the nerves, off that canal. That quick relief doesn't mean anything's cured. It simply tells us that the pressure might be coming from your lower back, not from poor circulation, not from weak muscles. Understanding why that happens is the key to fixing it safely. So let's take a look at what's really going on inside your spine when you stand for too long. So what is this test telling you about your spine? Well, what you just felt during that test is a classic sign of something called lumbar spinal stenosis. That simply means there's less space or narrowing in the lower part of your spine that your nerves would like. Think of the spinal canal as a small tunnel that carries your nerve roots from your back down to the legs. Over time, that tunnel can narrow. Sometimes the joints in the back thicken a little, sometimes the discs lose height or bulge, and sometimes the ligaments thicken. All of that slowly closes in on the spinal nerves in the lumbar spine. When you stand up straight, that tunnel naturally tightens even more, and the nerves inside have less room to move. That's why you might start to feel heaviness, tingling, or weakness in your legs after standing or walking for a while. It's not poor circulation or a lack of strength. It's simply a mechanical pressure on the nerves that your body feels as fatigue or loss of power. When you lean forward in the test, you opened up that tunnel up further. You actually got more space back in there. The space widened, the pressure dropped, and those nerves could finally breathe again. That's why your legs felt lighter almost immediately. Now, the fact that you felt relief by leaning forward tells us this pattern is more consistent with a type of nerve compression called lumbar spinal stenosis. In stenosis, the canal that carries your nerves narrows when you stand tall or lean backwards and opens when you bend slightly forward. That's why the forward lean feels easier. It's important to know that not every cause of leg pain behaves this way. For example, a disc bulge or herniation often creates the opposite pattern. Bending forward can actually make the pain worse, while standing tall or arching slightly backward can bring relief. Both problems can affect the same nerves, but they behave differently because the pressure comes from a different direction. Understanding which pattern fits your body helps us target the right treatment. In our clinic, we often see patients with body issues, with actually both issues in the body, a bit of a narrowing from stenosis and a mild disc bulge adding to the pressure. The good news is that both can usually be managed without surgery once we take that pressure off safely. Now that you understand what that test showed, let's use the same idea to get real relief while you're standing or walking. This is a simple move you can do anywhere, and it follows the same principle that just made your legs feel better. Stand about a foot away from a counter. a table, even the back of a sturdy chair. Place your hands flat for balance. Keep your feet shoulder width apart. Soften those knees and slowly hinge your hips back, letting your chest lower slightly toward the counter. You should feel your weight shift gently towards your heels. Stay in that position for 20 to 30 seconds while breathing deeply. Don't force anything, don't push it into pain. As you hold it, notice how your legs feel. Most people will sense that heaviness fade and a bit of warmth actually return. What you're doing here is, again, you're opening up that space in the lower spine just like you did in the test. This takes pressure off the nerves and it improves blood flow and nerve flow to the legs. When those nerves have room, they can send stronger signals and your legs will feel steadier. You can use this move whenever you start to feel your legs getting tired or wobbly while standing. If it helps, it tells you the issue is mechanical pressure, not weakness. You can repeat that 2 or 3 times a day or anytime your legs begin to feel heavy. The goal is to keep the nerves happy and the pressure off before the discomfort builds. Next, I'll show you how to apply the same idea while walking so you can move farther and stay comfortable longer. When you're out walking and you start to feel that same heaviness in your legs, try this. Take a short break and lean forward slightly, hands resting on something sturdy like a park bench, a railing, or even a tree. Let those knees soften, let those the hips shift back a little bit. Hold that for a few seconds, then stand tall and keep going. You'll usually feel the pressure ease and your legs start to feel lighter again. It's a small adjustment that gives those nerves a bit of space and helps you walk farther without that fatigue setting in. Lumbar spinal stenosis is definitely not something to ignore. When those nerves stay under pressure day after day, the symptoms don't just fade on their own. The pain, the leg weakness, the loss of endurance can slowly increase until even simple things, standing to cook, walking through a store, or enjoying a short walk outdoors, becomes difficult. Over time, the muscles that these nerves control can weaken, balance can decline, and the constant pain or numbness can start to affect your mood and your sleep. Many believe that surgery is the only answer, but that's not true for most cases. In our clinic, we focus on non-surgical solutions that aim to restore movement, reduce nerve pressure, and help you regain your strength safely. One of the advanced methods we use is something called non-surgical robotic laser spinal decompression. It's a gentle, computer-controlled system that helps create more space around the affected nerves while promoting tissue healing with therapeutic laser technology. Over the past 35 years, we've helped thousands of people recover from spinal stenosis, disc bulges, herniations, sciatica, and other degenerative spinal conditions with an overall success rate in excess of 90%. The goal is always the same: less pain, stronger legs, and a better quality of life without surgery. If your test was positive and you want to see exactly how we treat lumbar spinal stenosis and relieve that nerve pressure without surgery, go watch this video next. It shows you the full system we use in our clinic to help patients walk farther, stand longer, and avoid surgery.